Sunod lang.
Inspirasyon ang hatid ng pagdalaw ng mga mahal sa buhay ng housemates. Leksyon at inspirasyon din
Atoy,
ang
listen,
hatid
Vic.
ng phenomenal na bisitang si Vice Ganda.
Today, we are going to talk about cold food. Have you ever heard someone cough and it sounded like a barking seal? That might be a croup. Croup is an illness that makes it hard for kids to breathe in and causes a funny sounding cough, just like a seal bark. It happens when the throat gets swollen and makes a noise when you breathe in, and it's called stridor. Affected areas are the larynx, trachea, and the bronchi. Croup is super common. It usually happens to kids between 6 and 5 years old. Doctors see thousands of cases every year, especially during cold season like fall and winter. So, mommies and children, let's also remember that there are two types of croup, which is the viral croup and the spasmodic croup. Viral croup, this is the most common kind. It happens when a virus, like a cold or a flu, infects your throat and airways. It usually starts slowly with a stuffy nose, sore throat, and maybe a fever. Then at night, your throat swells up and suddenly you start coughing with a barking sound. Your voice sounds hoarse and it can feel hard to breathe. So, spasmodic croup, this comes suddenly at night and might not even have a fever. I call it a ninja because it comes suddenly without you knowing it, and it often comes at night without warning. 1 minute you're sleeping fine, and the next minute you're coughing and having trouble breathing. There's usually no fever or cold before it, and it just pops up. This is usually in kids who have had croup before. Spasmodic croup goes away quickly, but it can come back again in another night. So, what are the risk factors of croup? You're more likely to get croup if you're between 6 months and 5 years old. You've had a cold recently. This is the pathophysiology of croup. Let's imagine what happens inside your throat when you get croup. When a virus gets into our body, it makes the part of our throat near our voice box swells up. That's the area where the air goes in and out when you breathe. Now imagine, you're trying to drink a smoothie through a squish straw. That is what it feels like to breathe with croup. Air has a hard time getting through, and it makes the barky, coughy, and squeaky breathing sound. So croup can sound a bit scary, but don't worry. Here's what you might notice when you are having croup. One is a barking cough, like a seal, stridor, or a squeaky sound when breathing in. Fever, hoarse voice, trouble breathing, especially at night, and waking up coughing. So, usually doctors don't need fancy tests. They can listen to the cough and look at how you breathe, and they can automatically know that you have a croup. But sometimes, they might do neck x-ray or the stipple sign, which is the subglottic narrowing of your trachea. Pulse oximetry, which is to assess the oxygenation and the saturation. CBC, if bacterial superinfection is suspected. And viral swab or the PCR to confirm viral agent, though not routinely necessary.
Hi guys! Today we're talking about something called bronchopulmonary dysplasia, or BPD for short. It sounds like a big and scary word, but don't worry. I'll help you understand it. BPD is a lung problem that mostly affects babies who are born too early, and we call it the preemies. What causes BPD? Sometimes babies are born before their lungs are ready to work properly. So doctors help them breathe using special machines and oxygen. But using those things for a long time can irritate the lungs and cause swelling and scarring. That's the cause of BPD. BPD is more common in babies who are born before 28 weeks, weigh less than 1,000 grams, and that's so tiny that the doctors need special oxygen machines for them to be able to breathe. About 1 in 4 preemies born before 28 weeks may get BPD. So here's who's most at risk for getting BPD. Babies born too early, babies who need a ventilator or a breathing machine, babies who had infections or lung inflammation, babies who needed a lot of oxygen. So now, this is the pathophysiology of bronchopulmonary dysplasia. Let's take a closer look at what's really happening when a baby has a bronchopulmonary dysplasia. Let's imagine the lungs are like a tiny spongy balloon filled with millions of air sacs called the alveoli. These alveoli are super important because the body gets oxygen in, pushes carbon dioxide out, kind of like a tiny oxygen highways. So here's the thing. In previous babies who are born too early, those little air sacs aren't grown yet or not yet fully developed. It's like trying to use a cookie that is still soft in the middle. Not quite ready. So doctors give the baby extra oxygen and sometimes use machine-like ventilators to help baby breathe. And that's really helpful for them. But you know, sometimes those tools can be a little rough on the baby's super delicate lungs. Let me explain what happens in BPD step by step. So now, let me explain to you the step-by-step of what really happens in BPD. Number 1 is injury to the lungs. Too much oxygen, lung infections, or high-pressure air from machines can irritate it and inflame the lungs. That means the tissue inside gets red, swollen, and sore. Kind of like a scraped knee, but inside your lungs. 2. Healing gone wrong. Normally, your body heals damaged lungs just fine. But in BPD, the healing process goes a bit sideways. It causes scars instead of smooth, healthy tissues. These scars make the lungs stiff, like trying to blow up a balloon that's been left out in the sun and got all scrunchy. So, to better understand this, let's picture it like this. Imagine trying to drink a milkshake through a super thin straw that is squished. Hard, right?
Yes!
That's what breathing can feel like with BPD. And just like you might give up on this milkshake, the baby's body gets tired from trying and trying to breathe so hard. That's the inside scope on what's happening with the lungs in bronchopulmonary dysplasia. The lungs are injured, don't heal the right way, and end up stiff with fewer working parts, which makes breathing and getting enough oxygen harder. So now, let's move on to the signs and symptoms of BPD. First is breathe fast or hard. Have noisy breathing, which is wheezing or crackles. Look pale or even bluish if they don't get enough oxygen. Get tired during feedings or having trouble gaining weight. The laboratory test for this disease or illnesses is using X-ray to look for the lungs, check for oxygen levels, watch how the baby is breathing, and if the baby still needs oxygen at 36 weeks corrected age. We can also help babies with BPD Doctors and nurses help by giving extra oxygen, but not too much. Using medications like diuretics. Diuretics is to reduce fluid, bronchodilators, which is to open airways, and steroids to reduce swelling. Making sure babies eat well to grow strong lungs. And sometimes using breathing support like CPAP or ventilators. So nurses watch the baby's breathing, give medication, and help with feeding. But guess what? Parents can help too. For parents, keep your baby away from smoke and sick people. Make sure your baby gets all their shots or vaccination shots. Follow up with a doctor regularly and learn how to give oxygen or meds at home if needed. Because healing takes time and you are part of the team too. Thanks for learning about bronchopulmonary dysplasia with me.